everybody, I'm back. This is Elisa, and so we're going to go through kind of just really briefly the last parts of the blood topic, and that is really about platelets and coagulation. So there's a lot of complexity here, and so just depending on what you need to do for our class, you don't have to memorize all of this. But I need you to be aware that it is out there and there is quite a bit to it. Primarily because a lot of you all are going into medicine and this is going to be important that you understand this. There are lots of different bleeding disorders that are there's just, as you can see, there's like a lot of different points where we can have this interaction. Okay. The other things are you need to know about the different mechanisms and whether they're coming extrinsically or from the outside, right, or intrinsically from the inside of the platelets. Also, this was the really best like blood clot picture that we had on this, so I wanted to make sure you saw that. Okay, as we've been talking about the liver and the spleen stores quite a bit, like 40% of the platelets, but the liver itself is also going to be important in manufacturing some of these like key um, coagulation stimulating factors such as prothrombin and fibrinogen, right? And so just things to be aware of. So, in a nutshell, the extrinsic pathway is initiated by damaged tissue, and it's when it releases what we call thromboprosten, aka factor 3. And you'll see a lot of these factors by number. Um, what that does is it begins what we call a cascade. Remember, we talked a little bit about cascade, meaning like one thing leads to another, leads to another, leads to another leads to different factors to begin the process of coagulation. And then there is also the intrinsic pathway. So what this is this is actually something that's coming from the platelets themselves. So they're releasing factor 7 here. So this is also known as the Hagman factor to begin cascade on a few others. So one to the next to the next. And what's important also is calcium, positively charged ions for either pathway to really become significantly engaged. So the idea of the cascade in clotting is this, that there are a lot of steps to it. And each one of the ability to form a proper and effective blood clot requires each one of these factors, each one of these steps in the cascade to become appropriately and like regularly released into their step, right? And so one thing to the next to the next. And in these cases, these are really in the production of just releasing fibrin from fibrinogen. So it's going to take some time. Um, so the completion of coagulation, so activation of factor 10, factor X, leads to production of prothrombin activator. Prothrombin activator, which you would guess is prothrombin, so that's going to convert to thrombin. Thrombin is the final stepping stone that is going to change and open up that fibrinogen. Remember, it's tightly sealed up in these little like packets that can float like with no problem through the bloodstream into fibrin, right? It releases them out and converts them into these long fibers we can use as duct tape to help seal and close down any kinds of platelets or a lot of cases, a lot of red blood cells into that clot, that final scab we need to form. An important part of the sticky is actually factor 8, which is going to cross-link or cause like a cross-hatching, making the fibrin strands all stick to each other, right? Which is very important. Um, Thrombin also forms a prothrombin activator, so it means it's like cyclical, right? It's a positive feedback loop, is what we refer to that as. All right, let's see here. Feet of the blood clots. So we really start going down to what we call like a wet scab in hopefully about 30 minutes. So it does take a while. If it takes longer than that, it needs to be noted. Clot retraction is not clot formation, but it's when it's like actually kind of binding down. Remember, that's like the difference is there's clot formation and then there's scab formation is what I like to call it, even though it's probably not entirely accurate. So that's why it's at the 30-minute mark. If you ever had like, a fresh cut, say on your hand or something, oh my gosh, this is like the worst hand ever. on your hand, and you have a little cut, and it's bleeding for a little bit, and see, I just like went with the terrible hand thing, and then it forms like that kind of squishy scab first. Clot retraction is when we actually flatten that out. Other things that are important is it's going to stimulate, or it's going to drop out growth factors, which is going to tell tissue to start making fresh endothelial cells. Mitosis is going to be in effect. And so that's also a stimulant for fibroblasts in the formation of kind of like maybe a scar in some cases, but also smooth muscle, which we find in the blood vessels themselves to repair that damaged vessel. Fibrinolysis, lysis meaning to break apart, split open, is when we are done healing up and we're going to dissolve the clot, right? So what ends up happening is we have different factors that are going to kick in different enzymes, which is going to start eating up or dissolving those fibrin strands, right? And here's another cascade, which for our class you don't have to know, but you do need to generally know the idea that plasmin is going to work to eat up those fibrin fibers. Okay. Platelets don't adhere to, remember, the prostacyclin coated endothelium, so they'll just kind of slip on by. Thrombin dilution is going to be diluted by just blood being able to finally go by. So there's that. Things to remember, especially those of you in medicine, is when a heart starts slowing down for various reasons, especially for maybe blood loss or shock. What can happen is the blood can start clotting in situ, like in the vasculature. So that's just kind of a side note danger to especially shock. Right, and there's a lot of that, but we'll talk about that in pathophysiology. Natural anticoagulants are going to be things like heparin and antithrombin. So sometimes these are also going to be used in the immune response, right? Getting pathways available for white blood cells to travel effectively. Hemophilia, we talked about, is hereditary in most cases. So we have some pretty famous hemophiliac families that we've been able to look at. There are lots and lots of types. There's sex-linked, there's autosomal, there's von Willebrand's, there's like partial. So just, lots of different ones to think of. Thrombosis is when we actually form a clot where we don't want it. Oh no, right? In an unbroken vessel, this might be like stroke, blood clots in veins, or other places. Pulmonary embolism is different when we have a clot that breaks free and it's traveling to the lungs, right? Embolus is anything that can travel in the blood and then it'll block blood vessels when it finally does like dock and like just stick in somewhere. Infarction is the process of tissue death as a result of lack of oxygen once the clot has blocked that blood supply to that organ, right? We know that as also stroke, largely myocardial infarction here. Okay, so clinical management of blood loss is lifestyle, diet, exercise, water, all the good stuff, having not inherited factors. Preventing clots. Vitamin K has been has been implicated in being helpful, as well as a couple of other drugs, including Coumadin, warfarin. Um, it's because it's important in the synthetic factor, right, of these key clotting factors themselves. So other anticoagulants are being discovered as we go. So interestingly enough, like when a leech binds onto you, they actually spit out a bit of anticoagulant. So do mosquitoes. Yuck. Um, Dissolving clots that are already formed, right? So folks that have had a stroke, have had blood clots in the legs, we usually use different methods, including enzymes that can kind of go in and start chewing away at different clots. So they're going to be used to dissolve these clots. It really digests lots of proteins, but there's negative side effects as well. TPA, or tissue plasminogen activator, as well, is more specific. And a little bit less abruptly destructive to other tissues. um, as well as some agents that are produced by leeches as well. So hematin is one of them. And that's it actually. Oh my gosh, that's blood. So I hope you had a good time learning about the blood. And all right, have a great day. Bye.